Many men are born with a small degree of curvature of their penis. It's usually a downward curve, and it's called congenital penile curvature, and usually the extent of curvature is relatively mild. Men who have Peyronie's disease will usually attend to the doctor requesting treatment, usually in their mid-50s, but it's certainly seen in younger men. Approximately 50% of these men will be able to recall an injury to their penis during intercourse. And many men will describe either hearing or feeling a snap or a pop. The current theory is that there are some of us who have probably an inherited disorder of wound healing. So just as many of us will develop exaggerated scarring with relatively simple surgery or with a childhood vaccination, there are some men who, because they have inherited disorders of wound healing, will respond to a minor injury during intercourse with an exaggerated scar, whereas men who've got normal wound healing may have a bruise for 2, 3, 4 days, which they may not even remember, which generally settles after a week. Well, this condition is most commonly seen in men in their 50s, but it can affect young men, and it's not uncommon to see young men in their late adolescence, early 20s or 30s, concerned about penile curvature who request treatment. This, of course, is the group of men who tend to be most upset about both the cosmetic appearances of Peyronie's disease and the loss of sexual function. The most appropriate person to talk to if you feel that you have this condition is your family doctor, your general practitioner, your primary care physician. In the vast majority of cases, he can make a diagnosis and refer you off to an appropriate specialist, most often a urologist or a sexual health physician, for treatment.